I'm Tom, I'm a clinical nurse specialist in cardiology, also an exercise instructor. Lots of my videos I refer to heart rate and heart rate zones. So we thought we'd do a quick little video about how we work out our heart rate zones and the different bits of kit that we use. So bog standard wrist-based stuff. Lots of the modern watches now, smartwatches, have wrist-based service. These are all right, but they're not anywhere near exact as these chest straps. Click on chest strap that sit right against the heart and can monitor the heart quite closely. I've got a Polar device on at the moment that's tracking my heart rate. There are slightly more fancy versions. These will do little ECGs while you're exercising. Problem with these, you get a lot of movement artifact. We're just going to run through a little bit about heart rate training zones. So we talk a lot about zones during our videos, and we also talk about it when we're with patients in the gym. So we've got a nice little slide here to demonstrate the different zones that we work in. So just to spin through them, so resting zone up to 60%, your light walks, gentle exercise, light intensity. People refer to this as the fat burning zone. I'm not a big fan of fat burning zone. It doesn't sound particularly. So we'll stick with light intensity. We've got the green zone. Obviously that's 70% to the 80%. And that's aerobic, so with oxygen, endurance exercise. Then we're shooting up now. Now these are getting the high hard working zones. 80 to 90 is the anaerobic without oxygen. And then the max is really pushing our limits. So we slip across to the next slide. So this is the area that we like to work with. All the benefit for patients, things like hypertension, recovering from heart disease, is this 60 to 75%. So we're crossing over zones here. So we're doing the light intensity into the aerobic stroke endurance. So heart rate up and keeping it up. Okay, so how do we actually work out our heart rate training zone? So when patients come to see me, I'll do it, and I've got a couple of different ways of using it, but this is the bog standard way of doing it. So 220 as a max minus your age. It gives you your maximum heart rate. Now, max heart rate, these are only a guide. So some people might get a max heart rate of 170 and they can find they work to that rate. There's no benefit of working at that weight and keeping it there unless you're training for very specific reasons. So for my crowd, as we just said before, that endurance, 60 to 75% of your max heart rate. Medications, so important factor, things like beta blockers have an effect on how the heart rate rises. You might affect your resting heart rate too, so we can take as many as 10 to 20 beats off. So let's look at a patient. So a 50-year-old gentleman, so he's on a beta blocker, so we've done 220 minus his age of 50 gives us 170. So 170 is our max, and we've deducted 20 beats for his beta blocker, gives us a 150. Now when you're working one-to-one with patients like I do here, I can work with that. If I notice the Borg scale, which we'll talk about in a later video, if we notice that that's too easy for the patient as their max, we can alter that. So how do we actually work out the zones? So that 150, so the 170 minus the 20, we times that by 0.6, which is our 60%, and that gives us 90 beats. So then to work out the 75%, same sum again, so we do 150 times the 0.7, and that gives us 112.5. So if I was setting a zone, initially we'd do 90 to 113. Now that's quite a tricky number. So once you start to work, you might notice 90 to 100, 100 to 120. We can work in there. But that's a simple way of doing it. Search online, there's lots of different other ways. Carvonian is a common scale that's used. But as a basic rule, all normal gym machineries, that's how they work. I hope that's helpful. Thanks for your time.